Hi, my name is Hunter. I'm 10 years old and like to play board games and hang out with my family and friends. When I visited my doctor, he told my mom and I that I needed surgery to help me feel better. After scheduling my surgery, a nurse from the Star office called and asked my parents all about me. They reminded us that I needed to have a physical to make sure I was healthy before my surgery. The next week, we went to UnityPoint Health, St. Luke's Hospital, where we met lots of nice people. They were all very friendly and helped me get ready for surgery. When we arrived, the friendly staff checked me in and gave me a lighted buzzer. I sat in the waiting room for a short time until my buzzer lit up and started shaking. That meant they were ready for me. A staff member introduced themselves to us and walked us to the weight machine to see how much I weighed. The nurse gently touched my forehead with a thermometer and rolled it behind my ear to check to make sure I didn't have a fever. Next, the nurse told me she needed to check to see how my body was working. This is called checking my vitals. I had done most of these things before at my doctor's office, so it was easy for me to help. The nurse then asked me to put my finger inside a gray plastic clip with a red light inside. This is called a pulse oximeter. It told the nurse how much oxygen was in my body and how fast my heart was beating. This is called a pulse oximeter. Then the nurse had me change into my hospital pajamas. The hospital pajamas are kind of silly because they snap in the back. Lots of people who work in the hospital wear pajamas too. The nurse said these are called scrubs. Hospital workers wear scrubs because they're the cleanest clothes in the world. Then I got to meet my doctor, the one who was going to do my surgery. He asked if my parents or I had any questions. After I met with him, I got to meet the sleep doctor. He's called an anesthesiologist. He said I would not feel anything during surgery because he would give me medicine to help me stay asleep the whole time. He listened to my heart and lungs and asked me to open my mouth real wide and stick out my tongue. Soon, it was time to say bye to my parents and head to the operating room. I wasn't scared to say bye because I knew they would be nearby, waiting for me the entire time. Once I was in the operating room, I saw lots of people. They were all wearing blue pajamas and blue hats, with masks over their noses and mouth. I was not afraid because I knew they were all friendly, and the masks are used to keep me from getting any germs. The sleep doctor let me hold a special mask over my face that helped me go to sleep. The next thing I remember is the sleep doctor waking me up to tell me my surgery was all done. I noticed I had a bandage on my hand, and under it was an IV. The IV is a small plastic straw that gave me fluid and medicine while I was sleeping during my surgery. It didn't hurt, but it was funny to see it taped to my hand when I woke up. I also remember feeling tired and a little funny when I woke up. The nurse told me that feeling funny was normal, and I would feel better very soon. The nurse also told me that I had a very important job. It was to keep telling her how I felt. When I woke up a little more, I was able to see my family, have a drink, watch some cartoons, and even eat a popsicle. Then the nurse took the tape and IV off my hand, which felt like a Band-Aid coming off. Then I was able to get dressed and go home. The day of my surgery went by very fast. I can hardly wait to tell my story with my friends and teachers at school. I sure met lots of nice people at St. Luke's Hospital. Everyone was really nice and friendly. My care team worked together to make sure I was safe and comfortable the whole time I was a patient at St. Luke's.